Hello, I'm Rosemary Barton. Welcome to a special edition of At Issue. At Issue tonight is the federal government's offer to fund healthcare enough for the provinces. Ottawa is promising to increase health funding to provinces and territories by more than $196 billion over 10 years, but only 46 of that is new funding, and that is well below what the premiers had been asking for.
To say the least, I think we were a little disappointed.
What we see this as is a starting point. It's a down payment on further discussions.
We would continue to push for more as well, but the needs are significant.
The Prime Minister says the deal is about more than just money.
We know that it's not just about money needed to improve our healthcare systems. We need better outcomes.
So what's to be made of this offer from the federal government? Is it enough to fix at least some of the issues we're seeing across the country? Will the provinces agree to it? Let's bring in our panelists, Chantal Hebert, Andrew Coyne, and joining us from Calgary tonight, Kelly Cryderman. Thanks for being here on this Tuesday, everybody. Chantal, what did you make of the offer that Ottawa put on the table?
That offer is maybe a bit of a misnomer in the sense that there is nothing here for the provinces to accept or refuse because the Government of Canada does not actually have to get their consent to say it's increasing the health transfer by 3%, 4%, or 5%. Stephen Harper dispensed with such a meeting and decided what the conditions and the increases would be going forward. And that was the end of that. And I think the premiers totally realized that. I think it was also clear from the meeting and what they heard that this was a final offer. And it's not even a take it or leave it offer because no one is going to leave it. Basically, this is where it's at. To your other question, will it fix the system? If money could fix the system, provinces received more than the rate of inflation, more than twice the rate of inflation over a decade. And here we are again today with not only the same problems that money was supposed to fix, but actually more acute problems that were not fixed.
Okay, lots to dig into, but Andrew, your thoughts on what was put on the table?
I'm not quite sure why we're attaching such drama or significance to it. They've essentially extended the existing fiscal arrangements out for another 10 years. So they'll get a 5% escalator versus the 6% that's been on for the last 10 or 20 years. Plus, there are these tacked-on bilateral deals, which will allow Ottawa to intrude itself to the maximum possible that each province will let it into the decision-making so it can be seen to be doing something about health care. I'm all for a strong federal government, particularly in things that are actually federal, but the feds don't have any special wisdom as to whether the provinces should be putting more money into mental care or into home care or what have you. So it's mostly, I think, to be seen to be doing something. Not only is more money not the answer to healthcare, it's the reverse of the answer. What we need is more accountability. What we need is the funding to be located at the provincial level. So instead of the feds giving the provinces a bunch of money they've borrowed so that the provinces don't have to pay for it themselves, give the provinces the taxing power to raise their own taxes and pay for their own healthcare themselves so that they're accountable to their own citizens and taxpayers and voters, rather than running to Uncle Ottawa every 5 years.
Okay, to be fair, there is, and you've all mentioned it, these side deals or bilateral deals yet to be negotiated. That's $25 billion on the table for the provinces. I know that's not the biggest number, but that is sort of the newer piece, I guess, that is there. And Kelly, I think it's also the piece that Ottawa is hoping provides some accountability, although in a different way than Andrew's suggesting.
Yeah, if you listen to the Prime Minister's words on this, he talked more about the bilateral deals than the general deal that was signed with the premiers. And I think, you know, of the new money, the bilateral deals make up the biggest component. And what we saw today was the political answer pre-budget. You know, we're going to start to see a host of provincial budgets coming up in the weeks ahead, then the federal budget. This needs to be settled to some extent before then. Then the Prime Minister and the federal Liberals offer these bilateral deals, which don't have to be linked to population, which allow the government to focus on those boutique issues and those important issues to specific provinces. It allows it to be more political as well. We're not talking about per capita funding. Now, the Prime Minister talked about these deals being settled within weeks. They could could be settled within weeks, but they could be settled within weeks, months, and years. We know how the federal Liberals have drawn out negotiations and provinces have drawn out negotiations on items like climate, like carbon pricing, like childcare, and I think there's the potential for that and a lot more politicking. So I think the federal Liberals have solved their immediate political problem while giving them the option to deal with the provinces on a one-on-one basis going forward for kind of an unknown period of time. And you said earlier, divide and conquer, and that's what it feels today like, even though the provinces can say they stuck together.
But there's urgency here too, Chantal. Even if we all agree that nothing's going to change overnight with more money, there is an urgency to be seen doing something for the provinces as much as there is for Ottawa.
Yes, and having watched the provincial news conference, I figure this is the end of this particular round about healthcare financing. Let's agree on one thing. At the end of the day, the provinces, and they insist on that, run their healthcare system. The next questions that will be asked of them. And I don't think that they can seriously argue that it's just because they lack money that the system isn't working. There is a lot of work and a lot of discussion to be had about healthcare in this country, but it's not a discussion, or the most important discussion is not just about money. That being said, on the political side, I think there are two groups or people who are happy tonight who were not in that meeting. One has to be Conservative leader Pierre Poilievre, who will probably have to live by what was negotiated today, and I think that would leave a Conservative government with more fiscal room than it had hoped for, looking at the big numbers and the kind of numbers that were going around, for one. And I think the Finance Department probably feels that it achieved, for once, what could be called restraint by federal Liberal standards.
Oh, look, yeah, that got a chuckle out of Andrew, so I better let him go next.
Well, you know, we've basically tried two non-reforms to healthcare. One is you just place an overall cap on spending and you don't change anything within the system, and lo and behold, you get shortages. And then periodically the feds pile in with a bunch more money, which basically just lifts the cap. So we're basically repeating that same pattern, only once more with gusto. It gets the federal Liberals out of a bind. They've had a few weeks now where they've had to retreat on a bunch of fronts. They had the provinces at their door, you know, causing them grief. So they've made the provinces go away, or at least for now. And they can sweep that off the table for now. But it will come back eventually, but maybe in a future government.
So is there no scenario here, no scenario that we're willing to contemplate the provinces staying united? I'm trying to say this without cracking a smile. Staying united and saying, we say no, come back with something better. Kelly?
But there's no no to be said. They don't have a yes or no to say to an increase in the health transfer.
Well, not this fiscal year.
Well, but couldn't you use public pressure and say Canadians won't accept this? You have to, I know, Chantal's rolling her eyes at me. Kelly, you weigh in first.
I think the political view of this is that it's not as much money as the premiers certainly would have wanted, but it is some new money, and the federal government can dangle that possibility of bilateral deals. I think, you know, there will have to be some progress from and the provinces are primarily responsible. Progress, something tangible, something getting better. And I think, you know, what is hopeful when they talk about things like removing restrictions to work between provinces, us acting more like a country in that regard, being focused on recruiting, and I think that's an underrated issue, and provinces trying to recruit from other provinces, that will all come into play. But I don't think there's a scenario right now, given the time crunch, where the provinces can go back to the drawing board and say, no, we're not going to take this money at this point, especially when the carrot is being held out of those bilateral deals. And that is almost a new funding model for healthcare, this new stream being created that obviously is acceptable to the big provinces, Quebec and Ontario at this point, since they've been talking about this behind the scenes for some time. You also see a lot of the other provinces taking their lead from that and saying, you know, if Quebec and Ontario are falling into line on this, we are probably too. Even a province like Alberta, which usually has, you know, more to say on these type of issues, is generally letting other provinces take the lead on this matter.
Okay, Chantal, you can roll your eyes at me again. Go ahead.
No, but seriously, if they were going to regroup and fight, I think they know that they can't stay united. I think there will be premiers signing those bilateral deals before the budget, not all of them. No. But if they were going to do that, their press conference today will be hard to erase from memory. And it did include François Legault, who has been adamant on this, saying, we will be back for another discussion with future federal governments in the plural. That does not sound like a battle that's going to be happening tomorrow. And when was the last time a province said, I don't want the healthcare transfer because it's not big enough?
One thing,
Andrew, Andrew.
One thing somebody should ask the provinces before they come back for more is what did they do with the money they were given the last time around? Yeah. Well, I'll tell you what happened. Since 2000, federal transfers for healthcare have more than quadrupled. Provincial spending on healthcare has only tripled, if the provinces were spending all the money that they got from the feds, they'd be spending about $70 billion more than they are. So what did they do with that $70 billion? They didn't put it to other purposes.
Yeah, and what do provinces like Alberta, who's going to have a huge surplus as well, what are they doing with that money? They're paying down their own debt. Why are they not putting that money into healthcare, Kelly?
Yeah.
Well, we do have a federal government that often brags about its debt to GDP ratio, while provinces carry a lot of the debt load in this country. I will point that out, that, the federal government constantly is talking about its good financial shape. And I think that is the problem this year, that there are so many financial pressures on this federal government facing inflation, facing a slowing economy, and that rubber hitting the road this year.
Okay, I got to leave it there. Kelly, thank you for joining us on this Tuesday. Andrew, Chantal, thank you as always. That was a good conversation. I appreciate it. Now we'll send things back to Adrienne in Toronto.